All right, so in treating patients with heart failure, there are some things that you are supposed to actually note as the healthcare provider, okay? There are some things that you should note when trying to treat patients with heart failure, okay? So it's not all about just trying to like cram in the drugs that can be used for heart failure and that, right? There are some principles that you should know before you actually even try to treat any patients with heart failure. All right, and that's what we'll be looking at. So important factors to note when treating patients with heart failure. All right, so these are the various ways to treat heart failure, but I feel like let's look at the factors at least. Yeah, we'll look at the factors first before summarize using all these pictures. So when treating a patient with heart failure, the following are important factors that you should note. Okay, accurate diagnosis first of all. You must confirm that okay, it is heart failure that is the problem. Okay, so accurate diagnosis should confirm the diagnosis of heart failure and identify the underlying cause. You know that heart failure due to precipitating factors like okay, there are some other disease condition underlying that are basically what causing the heart failure when they are triggered. Okay, so you should identify the underlying cause. The medication management. You should optimize medication regimens including what diuretics, um, angiotensin converting enzyme inhibitors, blockers, and inotropes. Basically, you should know the type of medication you are to use, and you should know, even if you are using multi medications, you know the appropriate ones that are combined. Okay, the fluid management, monitor fluid status and adjust diuretic therapy accordingly. Okay, blood pressure control, manage blood pressure to reduce what cardiac workload. Okay, the volume status, you should access and manage volume overload or depletion. All right, basically the blood in circulation. You should check for if the blood in circulation is too much or depleted. The electrolyte balance now, you should monitor and control what electrolyte imbalances, particularly for what potassium and magnesium. All right, then comorbidities, you should consider concurrent what conditions such as what atrial fibrillation, coronary artery disease, and chronic kidney disease. All right. The lifestyle modification, of course, you know that the patient has to actually what modify a whole lot of lifestyle because most of these cardiac diseases are due to what they are due to some lifestyles that the person is living. Either you're consuming food with too much cholesterol and all this stuff. Maybe you are practicing a sedentary lifestyle, you don't do exercise and all this stuff, right? So this include what dietary modifications, exercise, and stress reduction. Regulation monitoring. You should schedule regular follow-up appointments to assess patient progress and adjust for treatment plans as needed. Then patient education. You should educate the patients and their families about heart failure management, medications, and lifestyle changes. All right. The multidisciplinary care. This involves a team of what healthcare professionals, including what cardiologists, primary care physicians, and nurses. Okay, so you can see this is digoxin toxicity, anemic heart failure, correct anemia. Okay, you should check for digoxin toxicity. Oh, okay. Anemic heart failure should correct anemia, avoid fluid. They give is this oh this is like a whole lot of summary. Okay, diet, the patient should avoid salty diet, weight loss, basically check for diet control, and the patient should increase exercise. Okay, so guys, these are basically the important factors to note when treating a patient with what heart failure. So now, how to treat the heart failure? You should consider prescriptions such as what beta blockers. You should reduce salt intake to lower water retention. You should maintain a healthy body weight, do a lot of exercise. You should change your diet to include more fruits and veggies. And also you should talk to your doctor about potential surgeries if possible. All right. So these are the important factors to note when treating patients with what? Heart failure. All right. So bye for now.